recording now, Gareth.
Okay, so yes, so as Kieran has summarised quite well what the results entail, and I guess there's two ways of looking at this. There's the little bit of additional detail that Kieran has described, and for me that would be the graphs or the figures in terms of your results. For me, the key aspect of the results is essentially the p-value, which is defined by the confidence intervals that comes out of your statistical tests. So as Kieran rightly points out, you will have been given a number of risk factors to evaluate, and your role or your task is to determine whether those risk factors that you have been assigned are significantly associated with the disease outcome, and in this instance, the disease outcome is cardiovascular disease. So if you are writing a report, or you are writing a manuscript for publication or whatever, or a thesis, whoever's reading that, they want to be able to identify relatively quickly what are your key results, what are your main findings. And so I don't know whether Kieran went into any details. And normally when we're writing something like this, we'll have a table one. And I know that probably sounds a bit obvious, oh, you'll have a table one, but normally our table one will reflect some summary statistics of the cohort or the population that you have evaluated. So for example, you've got a group of individuals, some of whom have cardiovascular disease and some who don't have cardiovascular disease. And so sometimes then, you've now been given a range of risk factors, and that could be, for example, age or smoking status or blood pressure. And so, we would like to see a summary table that identifies which of those risk factors are significantly associated with cardiovascular disease. So for me, you might have the test statistic in that table. So it could be the t-test value or the chi-squared value. You could have the confidence intervals that show where the 95% confidence intervals that show whether they span the particular test value or not, and then present the p-value. And that way, anybody who's reading it can quickly go to that table and identify which of those risk factors that you've evaluated, which of those are significantly associated with cardiovascular disease. So for me, that's the key point in your results, is that table that allows someone else to come quickly, go to your results section, and quickly determine which of your risk factors are significantly associated with cardiovascular disease. So you can then include, as Kieran described, some of these outputs that you can get from your Excel file in terms of some of these graphs that Kieran has talked about. But certainly the main component of your results should be your table one that clearly summarizes your key findings. And it's not just your significant findings, it's all of your findings of all of the tests that you have run. So we're as much interested in finding out which risk factors are not actually a risk factor, so that we can identify or specifically target those factors that do increase an individual's risk for cardiovascular disease. So again, you provide a table, you may provide some figures or graphs, but you also need to provide a short summary that describes the contents of your table, or indeed, if you provide some graphs or figures, describes quite clearly and succinctly what those graphs or figures represent. And you should refer to those in your results. So if you say, for example, smoking status was significantly associated with the cardiovascular disease outcome, and in brackets put table one, so that the reader then knows that you've made a statement in terms of what your key finding was and where they can find the summary statistics related to that key finding. You then, obviously, if you're going to put in some graphs or figures, you should also reference those in the text that you write under your results section. So figure one or graph one or whatever you want to call it. And it's good practice to have if you have a table or you have a figure or a graph or a picture, as I said last week, it's good practice to have a little title and a little description, a brief description of what that figure or table or graph represents. So you just don't stick it in and leave it there and have whoever's reading it scratching their head wondering, what has this actually got to do with the results section? So in summary, the results section should be relatively brief. It should be clear and concise, and it should highlight the key findings of the tests that you have undertaken, which you should have described in your methodology. Does that sort of summarize, Kieran, reasonably well what you're anticipating?
Yes, because the only thing that I have added to that table, Gareth, is after the p-value, for them to put whether the results are significant or not significant. And then on another column after that, would they accept or reject their null hypothesis? I wanted them to be able to just see the continuity there.
Yeah, I think that's fair enough. We commonly do something similar, although not exactly like that. We commonly might put in, when we're writing up our results and getting them published, we might highlight either in bold or perhaps in some sort of highlighting font, or we might put in a little asterisk to indicate that a result is lower than the p-value, the significance threshold, or the p-value less than 0.05. But if you put in a separate column to indicate that, that's fine as well. But think about your presentation. So, for example, if you're obviously going to be writing or producing your report in an A4 style page, and if you end up having too many columns, then it sometimes can look a little untidy. So sometimes the way to get around that is, if you want to remove a column. So, for example, if you had a separate column that indicated whether it was significant or non-significant, you could consider using something like highlighting the significant values or underlining the significant values, or putting a little star or asterisk in to highlight those values that are significant. But yes, as Kieran says, it's important to be able to identify those values that are significant, because you've only got 3 values, but quite commonly when you're undertaking research, you're looking at many more. So it's important to be able to pull out quite quickly those values that are significant. And of course, then you need to be able to demonstrate that you understand whether you either accept or reject your null hypothesis.
Would it be reasonable as well, Gareth, to take the findings in the table then and break that into develop that into the discussion of the results by saying what they actually show and why, and then relate back to their biological knowledge that they put in the introduction about that in the discussion, and then to finish off with an evaluation as to maybe how they would further develop the questions that they studied after having gone through all that.
Yeah, exactly. So in your introduction, you should have set the scene in a quite a general way, insofar as you describe the issues around cardiovascular disease, its prevalence within society, whether it's in Northern Ireland, within the UK, within Europe, or within the US. It's not necessarily all of those, but give some indication as to how prevalent or the significance or the impact of cardiovascular disease in society. You will then have described in more general terms, one or more of the cardiovascular disease risk factors. And in your introduction, you will not have insinuated that you expect to find that one of those is significant within your data. You may have indicated that previous studies have found these risk factors to be significantly associated with cardiovascular disease. So your introduction is really an introduction to the subject area, to the disease, to the risk factors, and establishing that some of these have been previously associated with cardiovascular disease, but you're not intimating within your introduction that you necessarily might expect some of these to be associated with cardiovascular disease in your cohort data, because you don't want to necessarily make the assumption that you already have some sort of preconceived bias. So it's just really about the way you write it. But as you move then into the discussion, you've now completed your results section. You now are able to identify which risk factors are significant and which risk factors are not significant. And really it's at that point where you try to contextualize your findings from your data into what's been published previously. So for example, if you have found that, smoking is significantly associated with cardiovascular disease in your data, then you want to try and sort of substantiate that in the context of other studies that have also found that smoking is significantly associated with cardiovascular disease. And don't be worried, we're not expecting, lots and lots of written detail here. We're just expecting in the discussion that you are able to identify what your key findings are and how you can interpret those key findings and how those key findings relate to the findings reported in other studies. As Kieran points out, you really want to have an overall conclusion at the end of your discussion, and that might be, for example, our data supports the fact that along with other studies that individuals who are current smokers are likely to have an increased risk of cardiovascular disease. It's also in a study that we would be doing, we would also point out the strengths and limitations of our study. And you might want to think about that. It's not that we expect you to identify or list every single strength of the study or every single limitation to the study. But if you've actually read some of the literature and some of the previous studies that have been published around cardiovascular disease risk factors, you will get a flavor in the discussion section as to the strengths and limitations of some of those studies that have been previously published. And certainly a really strong student would be able to see if there are any similarities in those strengths or limitations from some of those other previously published studies and how that might impact or how that might relate to the study that you've undertaken here.
So Gareth, in summary, that's really what I was looking for, which was what do you include in the results, the tables, graphs, statistics values, and the discussion, the interpretation of those, and a reference to the previous studies and the biological knowledge, and then finish off with a little bit of an evaluation in terms of the strengths and weaknesses. So that's where we're going to try and develop early next week and try and get everybody happy with their introduction, then the results and discussions, and then we'll do a wee bit of work next week and checking with the references and that. So that's where we are in terms of the report write-up. I would say next week will be mostly just then trying to get the report structure, sort of at least a draft of the report structure, and that they're happy with that. And then the following week, I'll just work on the poster presentation, the mini summary, where we'll be using a PowerPoint template for previous years to design the poster. So
yeah, well, we usually find our students are quite good. Certainly, any of the students that I've come across are probably better at preparing their PowerPoint presentations than what I am. They're all very au fait with using the PowerPoint. But the only thing I would say, Kieran, and you've already said this on several occasions, is that there may be a few students out there who are a little bit daunted about putting this together. And trust me, we have lots of students. I have students coming in doing 3-year PhDs with me. And when it comes to actually sitting down and writing it, they sometimes get a little bit of a mental block or a struggle, or they get hung up on or fixated on a particular question that they're not quite sure how to interpret. And Kieran has said this on several occasions. Please drop either Kieran an email or myself an email. Don't worry. There is no such thing as a silly question. The silly aspect of it is if you get stuck on it and you don't ask for some clarification. So please, when you're trying to structure this, keep it simple, keep it clear, keep it concise, focus on the main points. And if you've got any questions that you're unsure about, in the first instance, drop Kieran an email, or if there's anything that I need to answer, I'm happy to answer that. So don't be afraid to speak up. It's all about developing your ability to work independently, developing your ability to work together as a group. So don't be afraid to ask any of your colleagues, how have you found this, or how would you interpret that, and what sort of approach you're taking to writing your discussion. Discuss it with each other or within your groups or with some of your friends. And if you've got any questions, direct them towards Kieran or myself.
And on that note, Gareth, has anybody any questions that they want to bring up this morning? Do you want to unmic or put anything in the chat? Because I know some people might want to stay on at the end from this group here to clarify some of the stats. I got emailed yesterday from some people regarding that, so I will offer that function at the end of this meeting. We can go through a few things. So is there anybody wants to ask Dr. McKay any questions that you want to put in the chat or on mic? No, I think we've managed to cover it, Gareth. I just have a few things, as I said, to go through with the students after this regarding I think the mechanics of a chi-squared and interpreting the chi-squared table. Some of them have asked, and then some have asked me to check a few bits of their data interpretation.
Okay, well, look, if you get any questions coming in, Kieran, just don't be afraid to forward them on to me.
Yep.
You need me to answer anything,